Do you remember when your grandfather's medicine cabinet looked nothing like the pharmacy aisle at your local drugstore? There was a time in America when a family's entire health arsenal fit inside a small mirrored cabinet above the bathroom sink. A brown bottle of hydrogen peroxide, a tin of Vicks VapoRub, a box of baking soda, some castor oil, a jar of honey. These weren't primitive substitutes for real medicine. They were real medicine used by generations of Americans who raised healthy families on practical knowledge and common sense remedies that cost almost nothing and worked remarkably well. Today, we're exploring 25 old-timer health remedies from the medicine cabinet that actually worked. Some of these have since been validated by modern science. Some have been quietly abandoned simply because there was no profit in selling something that cost 10 cents and grew in your backyard. And some might just remind you that the human body has been healing itself for thousands of years with a little help from the right ingredients. Let's start with Vicks VapoRub on the chest for congestion. Every grandmother in America kept a blue jar of Vicks VapoRub in the medicine cabinet and reached for it the moment anyone in the house started coughing. Applied to the chest and throat before bed, the menthol, camphor, and eucalyptus oil combination created a powerful vapor that opened congested airways and suppressed the cough reflex enough to allow genuine sleep during a cold or chest infection. Your grandfather swore by it. Modern research published in the journal Chest actually confirmed in 2010 that Vicks VapoRub significantly outperformed petroleum jelly and no treatment at all for nighttime cough relief in children. The old-timers were right all along. A jar cost about 35 cents in 1965 and lasted an entire cold season for the whole family. Using honey for coughs and sore throats. Before cough syrup became a $12 bottle of artificially flavored liquid, your grandfather stirred a tablespoon of raw honey into a cup of warm water with a squeeze of lemon and drank it slowly. Raw honey contains hydrogen peroxide, antioxidants, and antimicrobial compounds that coat and soothe inflamed throat tissue while actively fighting the bacteria that cause the irritation. A 2012 study published in Pediatrics found that honey outperformed dextromethorphan, the active ingredient in most commercial cough syrups for suppressing nighttime cough in children. The World Health Organization lists honey as a recommended treatment for coughs and sore throats. A jar of raw honey costs about 49 cents and treats every cough in the household for an entire winter. Applying a mustard plaster for chest congestion. This remedy sounds almost medieval to modern ears, but mustard plasters were standard medical treatment in American homes well into the 1950s, and for good reason. Mix 1 part dry mustard powder with 4 parts flour. Add enough warm water to make a paste, spread it on a cloth, fold the cloth over to encase the paste, and apply it to the chest for 15 to 20 minutes. The mustard compounds stimulate blood flow to the chest, create a warming heat that loosens mucus, and the vapors open congested airways. Doctors of the early 20th century prescribed mustard plasters routinely for bronchitis and pneumonia. Your grandfather's mother used them on him as a child, and he used them on his own children decades later because they genuinely worked. Gargling with warm salt water for a sore throat. This is perhaps the oldest remedy on this entire list and one of the most thoroughly validated by modern medicine. Your grandfather mixed a 1/4 teaspoon of table salt into 8 ounces of warm water and gargled for 30 seconds several times a day at the first sign of a sore throat. The salt solution draws fluid out of inflamed throat tissue through osmosis, reducing swelling and pain. It also creates an inhospitable environment for bacteria and viruses on the throat surface. The Mayo Clinic, the American Cancer Society, and virtually every major medical institution still recommend warm salt water gargling today for sore throat relief. Total cost was fractions of a penny per treatment. Before the pharmaceutical industry produced dozens of laxative products costing $10 a box, castor oil was the standard treatment for constipation in American households. A tablespoon of castor oil taken on an empty stomach works within 6 to 8 hours by stimulating intestinal muscle contractions and lubricating the digestive tract. The FDA still classifies castor oil as a safe and effective stimulant laxative today. Your grandfather kept a bottle in the medicine cabinet and considered it one of the most reliable remedies he owned. A bottle cost about 29 cents in 1960 and lasted for months. The taste was genuinely unpleasant, which is why Grandpa mixed it into orange juice and handed it to you before you knew what was happening. Applying raw potato slices to reduce swelling. When someone in the household took a hard knock to the eye or developed a swollen bruise, your grandfather reached for a raw potato before anything else. Thin slices of raw potato applied directly to swollen tissue provided genuine anti-inflammatory relief through enzymes and compounds in the potato flesh that reduce inflammation and draw out excess fluid. The cool temperature of the potato also provided immediate pain relief, similar to an ice pack. This remedy was used across multiple cultures for generations and remains a recommended home treatment in many countries today. A single potato costs 3 cents and could treat multiple injuries before it was done. Drinking ginger tea for nausea and an upset stomach, motion sickness, morning sickness, stomach flu, nausea, and general digestive upset were all treated the same way in your grandfather's house. He would slice a 1-inch piece of fresh ginger root, simmer it in 2 cups of water for 10 minutes, strain it into a mug, add a little honey, and sip it slowly. Ginger contains compounds called gingerols and shogaols that directly affect the digestive system and the brain's nausea center. Multiple clinical trials have confirmed ginger's effectiveness for nausea equal to or exceeding some pharmaceutical anti-nausea medications. The American College of Obstetrics and Gynecology recommends ginger for morning sickness. A piece of ginger root costs about 10 cents and makes enough tea to treat an entire day of nausea. Witch hazel was one of the most versatile items in your grandfather's medicine cabinet and one of the most underappreciated. Distilled from the bark and leaves of the witch hazel shrub, this clear liquid was applied to minor cuts and scrapes as an antiseptic, used as a facial toner to tighten pores and reduce oiliness, dabbed onto insect bites to relieve itching, and applied to bruises to reduce discoloration. It contains tannins that have genuine astringent and anti-inflammatory properties confirmed by modern dermatological research. A bottle costs about 39 cents and lasts for months of daily use. Today, the same bottle sits on pharmacy shelves largely ignored, while people spend $30 on specialty skincare products containing the same active compounds. Your grandfather kept apple cider vinegar in both the kitchen and the bathroom because he understood it had genuine medicinal applications beyond cooking. Diluted with equal parts water and applied with a soft cloth to sunburned skin, apple cider vinegar restored the skin's natural pH balance that ultraviolet exposure had disrupted, reduced inflammation, and provided cooling relief that lasted for hours. Applied undiluted to a cotton ball and held against a skin tag or wart for several weeks, acetic acid gradually breaks down the tissue. He also used it diluted as a rinse for dandruff, since the acidity disrupted the fungal growth responsible for flaking. A bottle costs 29 cents and it addresses half a dozen different skin conditions. Using clove oil for toothache pain. Before emergency dental appointments became a same-day possibility, your grandfather needed something that could manage a toothache through the night until the dentist could be reached. Clove oil applied directly to the affected tooth and surrounding gum tissue with a cotton ball provided powerful numbing relief within minutes. The active compound in clove oil is eugenol, a natural anesthetic and antiseptic that dentists still use today in temporary fillings and root canal procedures. A small bottle of clove oil costs about 25 cents at the pharmacy and provides immediate relief that lasts several hours. Modern dental products marketed specifically for toothache pain list eugenol as their primary active ingredient at 10 times the price. soaking in an Epsom salt bath for muscle pain. After a hard week of physical labor, your grandfather drew a warm bath, poured in 2 cups of Epsom salt, and soaked for 20 minutes. Epsom salt is magnesium sulfate, and the theory held by generations of Americans was that magnesium absorbed through the skin relieved muscle soreness, reduced inflammation, and promoted relaxation. Athletes, laborers, and farmers used Epsom salt baths as standard recovery treatment for generations. A 5-pound bag of Epsom salt costs about 49 cents and provides enough for multiple baths. Whether the magnesium absorbs transdermally remains debated by scientists, but the warm water soak itself genuinely reduces muscle tension, and the ritual of recovery was something your grandfather considered non-negotiable after hard physical work. Applying baking soda paste to insect stings. A bee sting or a wasp sting in the backyard was never a reason to go to the pharmacy in your grandfather's day. He would mix a tablespoon of baking soda with just enough water to form a thick paste, apply it directly to the sting site, and leave it in place for 15 to 20 minutes. The alkaline baking soda neutralized the acidic venom injected by bees, reducing the burning pain and swelling almost immediately. For wasp stings, which tend to be alkaline rather than acidic, he would use a dab of apple cider vinegar instead, demonstrating a level of practical chemistry knowledge that most people today simply do not possess. Both treatments cost fractions of a penny and worked within minutes. Drinking chamomile tea for anxiety and sleep. Your grandfather didn't reach for a prescription sleep aid when he couldn't wind down after a difficult day. He put a kettle on, steeped a chamomile tea bag for 5 minutes, added a spoonful of honey, and sat quietly for 20 minutes before bed. Chamomile contains apigenin, a compound that binds to the same brain receptors targeted by anti-anxiety medications, producing a genuine calming effect without dependency or side effects. A 2017 study published in Phytomedicine found that long-term chamomile use significantly reduced generalized anxiety disorder symptoms. A box of chamomile tea bags cost about 39 cents in 1965 and provided 20 nights of genuine sleep support. Your grandfather slept well and woke up clear-headed, which is more than most prescription sleep aids can promise. Using petroleum jelly to heal cracked skin, cracked heels, chapped lips, dry knuckles split from cold weather work, and minor cuts that needed protection were all treated the same way in your grandfather's medicine cabinet. A thin layer of petroleum jelly applied to damaged skin created an occlusive barrier that locked in the skin's natural moisture, prevented further water loss, and allowed the tissue underneath to heal without exposure to air, bacteria, or further irritation. Dermatologists call this method occlusive moisturizing, and they consider it one of the most effective treatments for dry and damaged skin available. A large jar of Vaseline cost about 29 cents in 1960 and lasted for months of daily use. It remains one of the most dermatologist-recommended products available today at essentially the same price adjusted for inflation. Applying a warm compress to the ear can ease ear pain. An earache in the middle of the night was treated immediately in your grandfather's house without a trip to the emergency room. He would heat a damp cloth in warm water, wring it out, fold it into a pad, and hold it gently against the affected ear for 20 minutes. The warmth increased blood flow to the area, relaxed the muscles around the ear canal, and provided genuine pain relief that allowed sleep until a doctor could be seen in the morning. He understood that most ear pain in children was caused by fluid pressure behind the eardrum, and that warmth relieved that pressure without medication. This simple treatment cost nothing and worked reliably enough that he used it on his children and grandchildren for decades. When anyone in the household came down with a cold, the flu, or any illness that left them weak and depleted, your grandfather's first response was to put a pot of bones on the stove. Chicken bones, beef bones, whatever was available, simmered for hours with onions, garlic, celery, and carrots. The result was a broth rich in collagen, gelatin, amino acids, and minerals that supported immune function and gut health. Modern nutritional science has confirmed that chicken broth contains compounds that reduce upper respiratory inflammation and support the immune response. The glycine in bone broth promotes sleep and reduces anxiety. The minerals support cellular function during illness. Your grandfather called it chicken soup. Scientists call it functional nutrition. Both are right. Activated charcoal for food poisoning. Activated charcoal was once a standard treatment in the family medicine cabinet, a common remedy in your grandfather's era for suspected poisoning and severe digestive upset. Taken mixed with water at the first sign of food poisoning symptoms, it binds to toxins in the digestive tract and prevents their absorption into the bloodstream. Emergency rooms still use activated charcoal today for certain types of poisoning. Many grandfathers kept a small bottle in the medicine cabinet and used it at the first sign of food poisoning, often preventing the worst of what could have been a miserable 24 hours. A bottle cost about 35 cents, and it was considered as essential as aspirin in a well-stocked medicine cabinet. Applying raw honey directly to minor wounds. Before antibiotic ointments became standard first aid, people used raw honey on minor cuts, burns, and abrasions as a wound dressing. Raw honey creates a moist, healing environment, releases small amounts of hydrogen peroxide when it contacts wound fluid, and has a pH that is hostile to bacterial growth. Medical-grade Manuka honey is now used in hospitals worldwide for wound care, particularly for antibiotic-resistant infections. Your grandfather was using the same principle with raw honey from a local beekeeper decades before medical researchers caught up with what the old-timers already knew. A jar of raw local honey costs about 49 cents and serves double duty as both a kitchen staple and a genuine first aid supply. These remedies did not come from a pharmaceutical research laboratory or a television commercial. They came from generations of practical people who paid close attention to what worked, passed that knowledge down carefully, and understood that the human body is remarkably capable of healing itself when given the right support. Modern medicine has given us genuine miracles, but it has also convinced us that we need a prescription for problems our grandparents solved with a jar of honey and a warm cloth. If you found these tips useful, give this video a like and share it with someone who still believes that simple solutions are often the most powerful ones. And do not forget to subscribe so you never miss the practical wisdom that is worth holding on to.